Hey there, welcome to our very first official episode of From Belly to Baby, the STL Pregnancy Playbook. I'm very excited today to have our first expert join us.
Hi.
Dr. Camaryn Chrisman Robbins. We don't have the uplighting or the Beyonce fan with us today. Sorry, we've put in the request. But
I asked. I hope I did okay on my own.
I think so. Yeah. It looks like professionals were involved all the way around. Well, Dr. Camaryn Chrisman Robbins is a OBGYN. She's a Washington University physician at Barnes Jewish Hospital, and we were just talking about this a little bit ago. It does get confusing for people all of the institutions. So you are a Washington University physician, so you're a doctor at WashU.
And I'm on faculty, as most of us are. So if you work at WashU and see patients, you do also have teaching responsibilities.
Okay, and you see patients at Barnes Jewish Hospital?
I do.
Okay, and a lot of your patients will then have kids who move on over to St. Louis Children's Hospital. So
absolutely.
It's one big happy family.
Mm-hmm.
And we're here today to talk a lot about the first trimester. And I know you have met many moms along the way who have been at your doorstep, the first person they've probably talked to after they've gotten that first pregnancy test. And I think that's the first question is, first of all, the very basics. How does a woman know she's pregnant? I know it's simple, but
it's not always simple, actually. It's not, because you can have irregular periods, you can have some bleeding when you're first pregnant, and it seems like it was a period, but it actually wasn't. You can have spotting and wonder if it was a period, so it's actually not easy for everybody, especially if you have a history of irregular periods. So really, the only way to know is a pregnancy test. It is possible to take them too soon, so they don't turn positive, even though you are very, very early in pregnancy. But that's really the only way to know. And I just tell all my patients, if you are worried you're pregnant, if you've skipped a period, if you think that something might be going on, please call us, because sometimes an ultrasound, sometimes blood work is important in addition to the pregnancy tests.
And are home pregnancy tests pretty reliable?
They are, but they're just being marketed earlier and earlier, and that just doesn't always catch you at a point where you have enough blood hormone that it will turn positive.
Well, and that was one thing I was just telling you, that when I first took a pregnancy test, I didn't expect it to be positive, and it wasn't. It was negative. 6 days later, I thought it was a little odd that I hadn't gotten my period yet, so I took another one, and it was very clearly positive. Mm-hmm. And at that point, I had read so much online within the next 2 hours about when pregnancy tests turn positive, I was convinced there wasn't enough hormone there and that I was going to miscarry. So is that a threat? I mean, are there signs, early signs like that would indicate miscarriage? When do people need to start worrying? Because the internet, I will tell you, scares the ever-living out of you right away.
Well, I think the worst thing I can hear when a patient is here in my office talking to me is, I went on Google. Because there's a lot of misinformation, and if you don't know the websites and you don't know what physicians contribute to the websites, it's hard to really know what is real and what is a little bit hysterical. That sounds bad, but
no, it's not.
It makes people really nervous. So having a negative pregnancy test, then a positive, really doesn't put you at risk of miscarriage, that in and of itself, because most likely you just took the first test too soon. Mm-hmm. The other thing people don't know is you can be an early ovulator or a late ovulator. So when you learn in science class in 6th grade, remember the boys and the girls go to separate rooms and they talk about sex. So you learn that you ovulate mid-cycle, and on average women have 28-day cycles, so that egg comes out at day 14. But a lot of people, if you take the home ovulation kit, you take little pieces of paper and pee on them every morning.
Yeah, Amazon sells it by like the thousands.
Yeah. Or you can spend extra money for the digital ones, that if you're going to ovulate, there's like a little happy face with a thumbs up on it. Yeah. But you can be someone who ovulates on day 8 of your period. You can be someone who ovulates on day 17. And what's tricky is the egg only lives 1 day. So if you're trying to get pregnant and it's not working, but you're timing intercourse right in the middle of your cycle, you could be missing that ovulation, which feeds in more to, how do I know when I'm pregnant? When do I take the pregnancy test? It's really tricky. But no, to answer your question, a negative when you think it might be positive, followed by a true positive, is not a sign of an unhealthy pregnancy.
It just is what it is.
It is what it is. It's all timing.
And it's really funny that you mentioned that, because all of the apps will tell you there's a certain window in which you are ovulating. And I can tell you they're not right.
No.
Or else I wouldn't be
Everyone's
pregnant today.
different. Everyone's different.
Mm-hmm. And so, obviously, your first line of advice is call your doctor.
Yes.
And if you don't have a doctor right away, if maybe this was unexpected,
call me.
What's the best way to go about finding someone?
You know, it's the first step is figuring out where your insurance will cover your care. And so call your insurance company. If you don't have an OBGYN, start there. Google places that are close to your home or close to work for you where appointments are going to be easy, because at the end of pregnancy you do need to come in every week, if not more, for different pregnancy complications. So it's got to be somewhere you can get to. And we have patients who I adore who drive 2 hours to us because maybe they have a complicated medical history, or maybe their baby's going to need somebody at Children's to take care of them. But that gets so tough in terms of time and money and time away from your kids and work. And it is what it is. And if that's the case, drive far to see a doctor that can take care of you. But really, somewhere close to home or work, somewhere your insurance will cover. I really, really love access to high-quality neonatal intensive care units. I think I have had so many patients deliver and have a surprise baby who doesn't transition to breathing well, or who has problems that we can't predict ahead of time, and that they just go down the hall to the NICU is such a relief, instead of that baby going in an ambulance or a helicopter and then mom still being at the hospital where she delivered. So when it's possible to have that choice, that you can logistically have your care somewhere that's attached to a high quality neonatal ICU, I think that's wonderful.
That's such a good point, and it's not to spook anyone, but the reality is that does happen. And one thing we haven't showed you about our setup here is that we do have someone who is holding the camera whenever we are visiting. Jenny, who had a baby at, was it 26 weeks?
27.
27 weeks, perfectly healthy pregnancy, unanticipated, and he is healthy and fabulous and 5 years old?
7.
Okay,
Time
he's 5
flies.
in my
Oh my gosh.
So
Oh my
he's 5 in my
gosh.
brain permanently. 7 years old, doing great.
Yeah.
So not only does it happen, but also very positive outcomes do happen when you do have access to great medical care. So that's a really good point.
Yeah.
So right back
What
to
were we
this.
talking about?
I was going to say, that's the beauty of Facebook Live.
Like veering in a different
And
direction.
it's a dangerous position because my train of thought goes off and it doesn't course correct very quickly.
Okay, let's get back.
So
Let's get back.
we'll get back to that first positive pregnancy test. You found your doctor. You're going to go in, have the blood test, all of that stuff to confirm all of the details. Make sure that, yes, you're legitimately pregnant. And then you'll go in for your first appointment. Let's talk about the
Yes.
first appointment.
Okay.
When does that happen? What to expect?
Perfect world, 7 to 8 weeks, because you want to be able to do an ultrasound to confirm a normal healthy pregnancy in the uterus that's about the size as the due date you thought based on your period. So if you come in at 4, 5, 6 weeks, a lot of times the pregnancy ultrasound is inconclusive, and you're kind of then in this limbo. Is it an unhealthy pregnancy? Am I miscarrying? Is something wrong with the pregnancy and my body aren't really matching up? And I think it's a lot of worry that could be avoided if you just wait 1 more week, and that ultrasound is going to show you the truth right then and there.
And I think it's also important for people to know one of the biggest surprises to me in that first ultrasound, and my husband went with me, was I was so expecting it to be one of those cute little moments where they put the jelly on your belly and...
Yeah, no.
No, that's not how it happens.
It's
Tell us.
transvaginal. It's a vaginal probe.
It's-
And the probe is like this long, but what goes inside your vagina is like this long, but you pull out the probe and people get a little nervous. It just goes inside like a little tampon, depth, and it sits against your cervix and takes pictures.
Perfectly fine. It
doesn't hurt.
Not
It feels
uncomfortable.
pressure.
But my reaction was, you're going to put that where?
Yeah.
And then
Yeah.
it was just funny, at my appointment, they didn't have the normal covers that they use on them, so she put a rubber glove over and she goes, just don't look. It's totally fine. It's perfectly healthy. I was like,
And
all
the
right.
normal covers are condoms.
Yes.
There's
yes.
nothing fancy about that. Yeah.
Even science, sometimes it's just the basics.
It
of
is
the
what
way
it
to go.
is. It is what it is.
So
Okay.
once you confirm everything is good there, what is the advice you give patients?
So and the other really important part of that first visit is a head-to-toe physical, including a breast exam. A lot of women don't keep up with annual exams when they're young and healthy, and that's kind of that phase of life where you be getting pregnant and growing your family. And breast exams are huge. Breast cancer is not something that you should only worry about when you're 40 and you start your mammograms. So I want everyone to have a good physical exam. We need to talk at that first pregnancy visit about underlying medical issues. Maybe you have sort of low-grade hypertension. Maybe you are pre-diabetic. Maybe you're diabetic. How does that all look for plotting out your care during pregnancy, your risk during pregnancy? Is this the time to say, hey, I'm going to recommend you see our high-risk doctors once or twice for consults? Is this something we're going to need extra ultrasounds for? You really give people a roadmap based on their history and their current state of health of what to expect for the next 7, 8 months.
And 2 questions based on the high-risk assessment at that point. How do you determine at 8 weeks if someone's high risk? What goes into that?
There's a lot of reasons that somebody may benefit from seeing a high-risk doctor. Something like twins or triplets. So twins I would take care of comfortably in my office, depending on how the twin pregnancy went. Sometimes I would call in maternal fetal medicine for help. Triplets and above, absolutely MFM. People who have just complicated medical histories, it's too hard to really list them, but I'm thinking of somebody who knows they have breast cancer, and they're about to start chemotherapy, they find out they're pregnant. Somebody who has liver disease. The liver is an organ that really takes a lot of strain during pregnancy. So if you know that you have liver disease, MFM is great for you. People who have blood that clots too easily, MFM, I might recommend that they go see them. And a lot of these things can be co-managed. We're literally in the same hallway. So if you were to come see me or anywhere else in, I know I'm not just speaking about our care specifically here, but anywhere that make sure that your OB works closely with maternal fetal medicine if the pregnancy takes a turn and that's where you need, or if you're complicated medically and you just want to talk to them ahead of time. And most community obstetricians do have a nice relationship with somebody in the region who's maternal fetal medicine.
And we were talking about that a little bit yesterday too, about how all this construction on Kings Highway that's been driving people in the St. Louis area nuts for so long does have a positive end result coming very soon, probably in early fall, with the new Women and Infants program at Barnes Church Hospital. So as you were saying, it puts everyone in the same hallway, moms and babies connected. So it is nice whenever you are scoping out a physician, if you do have those higher risk needs, to know that you can just walk down the hall. That's huge, that you don't have to be the one traipsing from one place to another, that you know, you're in homeroom and the teachers come to you.
Absolutely.
Yeah.
Okay, so your medical history, because let's not forget the mom. Everyone, immediately, you pee on a stick, you're pregnant, and it's like your brain goes to that baby, right? But my job is to think of the mom too. So who is she? What's her health? What's her physical exam like? Is she caught up on her pap smear? We run routine blood work. We want to know what your blood type is. Are you immune to rubella? Have you been exposed to chickenpox, hepatitis? Talk about genetic screening. So cystic fibrosis, if you are likely from a family tree that started in Northern Europe. Hemoglobin electrophoresis to see if you carry the trait for sickle cell, if you're from Africa and the Middle East. Thalassemia is another one we can test for. So these are things that we just kind of look at your family history and offer screening for different genetic conditions.
And how much discretion does the patient have in what tests they want and
they pick all of this?
Because one of them, you know, we were offered, I will say I'm 34 years old, so at 35 is when insurance begins covering, at least in is my education, insurance begins covering a lot of the tests. So at 34, one of the tests we were offered was, I believe, at 10 weeks, and we debated over it for so long. It was the one for the trisomies. So Down syndrome and there are 2 others,
13 and 18.
13 and 18. And we debated time and time again whether or not to go and have this test done, and it ultimately came down for, well, it wasn't covered by insurance, but it would probably be swallowed by, I mean, it's just it's kind of an odd...
It's very strange. So I misspoke earlier. Genetic testing, like testing to see if you carry the gene for sickle cell, testing to see if you carry cystic fibrosis. Those are sort of tests. I know it's like a medicalese word, but put those to the side. Genetic screening is seeing if there's a chance based on blood work and of you, an ultrasound of the back of baby's neck, to see if we can put some data in a big soup and figure out if you're at a higher risk. You were 34. if you're at higher risk based on all 34-year-olds in the U.S. of having this particular pregnancy based on these results, have too many or too few chromosomes, too many chromosomes specifically. So it doesn't say yes or no. Mm-hmm. So that's kind of the thing with a screening test. It captures a lot of people who are actually fine, and then you have another round of testing to narrow in and see if, yes, this pregnancy may be affected by a problem.
So it's not like 1 or 2 lines. It's a far more...
Yes.
You have to study that.
Something might be going on that leads us to believe you've got extra risk factors. Mm-hmm. So then you focus in. So these screening tests have a lot of people caught in that wide net who are fine. Mm-hmm. And you just have to take another step. If you wouldn't follow up with that next step, if you wouldn't go ahead and do a amniocentesis, and that's where they put the needle through your skin, mm-hmm. And get amniotic fluid for testing. A little earlier in pregnancy, you can do a CVS, which is a chorionic villus sample, where you put a small soft catheter through the cervix and actually take some placental cells. Mm-hmm. If you wouldn't do those things, and there's actually blood tests too, they can isolate baby's DNA out of your blood. It's like science fiction. I think it's so amazing. When I was pregnant with my first daughter, I was, I think, the first person in Memphis to get that test done. I felt very special.
I was going to say, wow.
But I don't want to tell you how much it was. It's now much more expensive than then, but less expensive.
Less expensive.
Less
no,
expensive
totally
now.
understand.
No. But if you and your family and your sort of values, and sometimes it's a religious issue, sometimes it's just talking with your partner about what would we do if. Mm-hmm. If you wouldn't take that second step, there's no point in taking the first step.
Well, and that was what
it doesn't tell you anything other than a big maybe.
And that was what our decision ultimately was that, in the conversation I had with my doctor was, based on where I work, we see a lot of these situations in which some of these pregnancies do come up with, the trisomies show up early and all of these issues. I see them a lot. And she said, you have to remember you work in a place where you see a very high concentration mm-hmm. of very unusual situations. And you can't base your decision on that. You have to base it on the conversations that you're willing to have now and the steps that you're willing to take. And my husband and I both came to the conclusion that we didn't want to have the next conversation, honestly.
Yeah.
I mean, that was the true for us, and it's very different for each couple and for each woman. But for us, that was our situation, so we didn't go through with it. Perhaps that would be different 2 years from now, I don't know. But so it is up to the individual,
totally.
up to the couple or the woman.
Mm-hmm. Mm-hmm. And you've just got to... These first visits are so hard because there's a lot packed in, and at this point you don't know your doctor very well. Maybe mm-hmm. you're in a new place. That rapport builds over time, but by the end of the pregnancy, hopefully you're like feeling mm-hmm. really comfortable, like you've got a team behind you.
Yes.
But at the beginning, it's hard, and you're going to be asked to make some pretty big decisions. And not decisions you can't undo or take back, mm-hmm. but these are kind of big things that you're going to have to come into that visit ready to answer. And it's good that we're doing this, because maybe a couple people will watch this and say, oh, I better look that up, because mm-hmm. I have my new OB appointment next week and I want to know mm-hmm. a little bit more about this, so I can start that conversation with my doctor from a little bit more of an informed, prepared place.
Well, and I think too, you compound on top of all of these seemingly overwhelming decisions the fact that there's a lot going on in your body and in your head. And
yeah, you're nuts.
Completely.
You're nuts.
And that was my issue, because everybody, we were talking about this earlier, everyone talks about nausea with pregnancy. I felt kind of crummy, but I wasn't sick every day. I was very lucky. Mm-hmm. I cried all the time. I'm not a crier. Mm-hmm. And I was convinced at one point that I needed to be evaluated for depression, and I work with enough doctors that I was able to say to one, do I need? And they were like, here are the symptoms. Do you match up with 2 of them? Crying in a corner in and of itself mm-hmm. is actually a fairly normal symptom of pregnancy. I mean, what kinds of things are women going through, and what's happening within their minds and their bodies that it would help to know is actually kind of normal?
It's all normal. And here's the hard part. You can want so badly to be pregnant mm-hmm. and really have a hard time with how you feel when you're pregnant. I think there's this lack of sympathy from friends, family, coworkers, partners, because there's this thought, well, you wanted to be pregnant, like, mm-hmm. suck it up, lady. And I don't think pregnancy is a disease. I don't think you should have the mindset like you're suffering or that you're diseased. I think there's a really magical fine line to find, and I don't have the secrets for it. Believe me, I didn't have trouble when I was pregnant. I'm one of those really annoying people that loved being pregnant. Postpartum was really, really hard on me. But being pregnant, so I can't say that I experienced, I mean, can you imagine the women who vomit 40 times a day?
My sister-in-law
for
was
6 months?
From 6 weeks to 36 weeks.
I mean, it's legitimately hard for a lot of people in a lot of different ways. And it's okay to talk about it, and I would encourage one of the ways partners can be really supportive, best friends, moms, mothers-in-law, fathers-in-law, is to try not to say things that diminish it, like, well, you're pregnant, or you wanted to be pregnant, or, you know, but to just say, how can I help? That's it. How can I help? Maybe you've been vomiting all day and you'd like a little Gatorade. Oh, Pedialyte. They didn't pay me for this, but I love Pedialyte. It's got so much less sugar than Gatorade.
Really?
It's really good.
Oh, good
Pedialyte.
to know.
And they do popsicles. Like, if all you can do is you can make ice cubes of Pedialyte and melt them in your water just for a little flavor. I'm telling you.
Well, that is a handy tip right there.
Dear Pedialyte, please call me. No, just kidding. I'm one of those academic physicians who's completely unsponsored with no finances to disclose, but...
And we'll take all of the advice because that's really important.
Yeah.
And stuff like that is very useful. But
Yeah.
when going back to your point about how people can be supportive, I mean, that was the hardest thing. Because one, I didn't feel like I had a right to complain because,
That's the problem.
we didn't expect it to
Because
happen.
then you start to feel shame or guilt or
like I'm not grateful.
Yeah. Yep.
And then on top of that, there were days I honestly wished that I would be somewhat physically ill so that it would prove that something was wrong.
Yeah.
You know, just because I felt so off. And my biggest issue, and I feel so silly admitting this, was that while I didn't start gaining weight right away, your body starts shifting and you look different. I mean, raw size changed almost immediately, and weight starts moving, and I wasn't losing weight as a lot of very unfortunate women do in the first trimester from being sick, but I was gaining it a little bit, and I was having horrible anxiety over how I was just going to look. And it sounds so superficial to say that, I know, when this is something I wanted and it's for the right cause, but it's still something you have to adjust to, and giving up your body to for a greater good in this instance is hard.
Can I take this opportunity for a PSA?
Please do.
Be prepared. You will need, between pregnancy, postpartum, and breastfeeding, 8 different size bras.
6 weeks was when I went in and had to get new ones first time. Yeah.
It's ridiculous. You cannot stay the same size for a bra. And a lot of people just do sports bras, and that's fine, but there's so much that happens. And whatever fits you will in 3 weeks not fit you, and then you have your baby, and then hello, it goes even to the next level.
Yeah, I've learned to love sale racks. I mean, because you know that in a couple of weeks things are going to change.
Yeah,
and it's a lot to wrap your mind around in just a couple of weeks when this is all happening so rapidly. But to that point, the whole thing about as soon as you find out you're pregnant, if you can eat, the idea that you're eating for 2 is apparently a little bit of a misnomer. Please explain.
Yes.
You mean I don't get 4,000 calories a day?
Please don't double your calories. So, developing pregnancies are the perfect parasite. They take what they need. If you have any kind of balanced diet, take your vitamins if you can. Top secret truth, you don't need prenatal vitamins. Prenatal vitamins are great. So many people have nausea and heartburn from taking them because they're so big. I want everyone on a multivitamin. If you can take them, great, but it's kind of voodoo to make people feel like they have to be forced to swallow these big horse pills. And if you are not on birth control, please start a multivitamin way before you're thinking of getting pregnant, because we want your folic acid stores to be up so you prevent spina bifida or the failure of the spinal cord to close in babies. So multivitamins, if you're not on birth control, even before you try to officially try, and I would argue if you're not on birth control, you're kind of trying, right? So multivitamins are great. So I'm somebody who, I've been pregnant twice, and I took Flintstones vitamins for both because I couldn't with the huge... Anyway, it's fine. My kids are great.
They're perfectly healthy. They're beautiful.
I eat a balanced.
Redheads too.
Darling. Oh, I know. I eat a balanced diet. I knew I didn't need the huge prenatal. So
and in that first trimester too, because that was, like I said, it wasn't sick, but all I really wanted was carbs and cheese. I lived on
your
grilled
parasitic pregnancy got everything it needed,
and that's what
that's
my
all you need.
sister-in-law, who, like I said, was sick the entire time, was told the exact same thing. You eat what you can,
and
go from there.
Yep, and please don't double your calories. The Institute of Medicine, suggested. I'm paraphrasing, so if anyone wants to quote me on this, I will accept the correction happily. But like 25-pound weight gain for the whole pregnancy, that's really hard. That was a tight, I think the thought was we're going to make a tight bar, and then people, when they go above that, if you say 50 pounds, everyone will gain 70.
Yeah.
But that was a rough one. That was years ago, and it may have been updated. But
25 to 35 is what I've read places.
Yeah.
I don't know how official said sources are, but that is what. I also know that my mother gained 60 some odd pounds. I think, granted, she was 5'2". And
I
so
gained 60.
You gained 60.
Mm-hmm.
Well, and it took a while to take it off. And then I have an aunt who the other day was telling me the story of having gone to the doctor after her second daughter was born, and she said her ankles weren't going back down to normal. They shrunk a little bit, but they weren't quite back to where they were supposed to be. She said her doctor just looked at her and said, "You do realize you gained weight in your pregnancy, that it just wasn't the baby coming out, right?" And so there's a balance. I think part of that, and you can totally correct me here, it's health for the woman, but also the baby's only going to weigh, 7 to 10 pounds, say? And then what do you lose in delivery? Do you lose a lot of it right away?
No. I mean, the weight of your placenta and the amniotic fluid around the baby is maybe, I'm making this up, I'm going to say 5 pounds extra of just fluid and stuff. But no, your body doesn't all of a sudden suction down. Eat what sounds good to you. Watch your portions. I'm way more of a fan of encouraging pregnant women to just be thoughtful of their portions, but be open to eating whatever sounds good to them. You can have ice cream every night if you give yourself a little ice cream because it's delicious, not sit in front of the TV eating your ice cream, watching This Is Us.
Oh, that's a great show, and it's really easy to sit there and eat ice cream straight through because it's also putting food on top of feelings.
Yes.
It works out well.
But exercise, stay active, and if that scale is getting towards the 25 pounds you're supposed to gain your whole pregnancy, which I think is rough for a lot of women to achieve, and you're at 12 weeks, then be thoughtful about those things. But you have to understand, we'll get to after the baby, or we're doing first trimester.
We're doing first trimester today, but we'll come back to you time and again for more tips.
So I won't get into the losing weight after pregnancy.
We'll leave that as a to be continued at some point. But
first trimester, eat what you can. Your baby's fine. Don't be scared if all you eat is grilled cheese.
Okay.
Your baby's fine.
And it was breakfast, lunch, and dinner. I mean, that's all I wanted.
And your baby's going to be fine.
And now, all I want are salads. So I figure somewhere in there, it's all balancing out, right? Okay, good. That and Ben & Jerry's. So, again, not a paid endorsement, but I would accept cartons of it on my doorstep if they did show up, more than Pedialyte. So I will also say, right around the time I found out I was pregnant, I was sick as a dog with a horrendous cold. Whatever was going through this community at the time, I had that cough that I felt down to my toes. And I swear it took me longer than normal to shake it. Is that true? Does your immune system take a hit when you're pregnant, or is that just in your head?
No, I think it's probably true. I don't know how to make this science-y, but your immune system is sort of suppressed in pregnancy. So, for example, somebody who has a history of abnormal pap smears, those can be caused by a virus, in most cases called HPV. Sometimes they may have another abnormal pap when they had all normals for a couple of years, just because the thought is maybe your immune system is down a little bit. If you have an illness, do you take longer to clear it, like an upper respiratory infection or something? I don't know. It seems true in my heart, but I don't know if it's true fact.
Okay,
I try to stay scientific.
That's one of those. I remember someone saying, this was a long time ago to a friend of mine, whenever you're pregnant, find the book that agrees with what you're experiencing and roll with it. And that's kind of one of those too that I just read it online somewhere. Again, I'm sorry about the Googling. And it just seemed to agree with how long it was taking. So and I couldn't take I could take, actually, I didn't know it at the time, could take cough medicine.
Yes.
So there are a lot of medicines out there over the counter stuff you can take.
Tylenol. Neti pots are great in pregnancy. If you've got a sinus infection you just can't shake, a lot of times just irrigating your sinuses really loosens things up and you get better faster. If you have a history of high blood pressure, it's not a good idea to take something like Sudafed, but if you don't and you just need to take it for a day or two, it's probably fine.
Okay. And I'm going to go ahead
and your doctor will give you a list. They should give you a whole list of what you can take if you get sick.
In that first appointment where I felt like I walked out of there with a full novel in documents, but one of them was the list of things you could take. Excuse me. And by then it had cleared, but I was like, oh, well, how about that? I could have taken Robitussin. It would have been just fine. So I'm scrolling down the list because I had to make notes in my first trimester so that I wouldn't forget all of this, because another thing that we have completely not talked about is the fact that when do you tell people? I mean, because there's this whole, you feel like crummy and you're not telling anyone and you're sick and you're trying to hide it and you're trying to go to holiday parties, and I mean, we had a convoluted system of rotating glasses, my husband and I did, and I don't know that it actually fooled anyone, but it felt like, wouldn't it just be easier if we told people and we didn't have to go with this charade? But what is the recommendation, and is there one?
There really isn't one. Everyone used to say 12 weeks, but I think that predated the availability of ultrasounds in the first trimester that help you at that first OB visit see if everything's okay, growing in the right place, there's a nice heartbeat. Now that we have ultrasounds we can do at 8 weeks, I think it's probably okay to tell people closest to you, because at that point, if you're 8 weeks and you have a normal ultrasound and there's a great heartbeat, you're less than 5% chance of miscarrying. So, unless there are other things going on, but I'll try to focus. Focusing's hard.
It's really hard.
Okay. But I think it's true that don't tell anyone you're pregnant for the first 12 weeks if you don't want to circle back to them if you experience a loss. So your best friend is probably going to be someone you lean on anyway. Your partner, your parents, your in-laws, whoever would be in that circle to help support you if you did miscarry. Or say you do the genetic testing and your personal decision when you find out your pregnancy is affected by trisomy 18, for example, which is very few kiddos live past the first year of life, I think it is, with that one. Maybe you would choose a termination and you'd want your people to support you, the closest to you. Of course, tell people that you want to be there for you. The nosy lady at work doesn't need to know, right? Because you don't want to circle back to the nosy lady, or guy. Let's not be gender specific. There are nosy men out there too, right?
Yes, there are.
So you don't want to make that circle wider than it needs to be, I'd say, for 12 weeks.
But yes, and it is an important point that miscarriage does not need to happen silently, that people can talk about it. And I mean, for us, for our purposes, I told my boss very early. I didn't tell all of my coworkers, but I thought, I'm dragging in the morning, and I'm very fortunate to work somewhere where I have a very supportive employer. So I knew that if something were to happen, A, I'd want her to know, and B, I'd want her to just kind of give me the flexibility to deal with it however we needed to. So for us, that made sense.
Oh my gosh, miscarriage is so common, and no one talks about it.
No one talks about it.
My patients have told me they feel ashamed, they feel so lonely, that they're going through this huge shift physically, emotionally, hormonally. Sometimes they have surgery that they don't tell people about. It's, only speak to what you're comfortable speaking to, but I would want to put it out there that if you ever brought it up in a room of women, you would be shocked how many people have gone through the exact same thing. And I think there's support out there that you may not even expect if you're comfortable talking about it.
And I think after this, we will go back and do a series of episodes just addressing very specific topics in the first trimester, because you and I we can go for hours talking about the generalities of the first trimester. Miscarriage specifically is one that's really important, and there's just, I think, a great need for women to know what the process is like, how it happens. Also, that it doesn't always happen, that you don't have to be terrified every day. I mean, I wouldn't talk about the fact that I was pregnant until we had that 8-week ultrasound, not even with my husband, because I was just so nervous that we were going to lose it. And I think you compound on top of all of that the fact that there are hormones still going buck wild in your body and altering the way you would respond normally, that it just is so much for someone to deal with. So we will go back and really pay deep attention to that topic. I think there's a lot of need out there for that. But as we're wrapping up now, are there any other topics that you think of when you hear first trimester?
I think we hit it, you guys. I mean, this is so I was envisioning, like, what do I do when someone's in my office? What do we hit? What do we talk about? Turkey!
Yeah, oh my gosh, lunch meat! Yes! What can't I eat? I've eaten goat cheese. Is that a problem?
No.
Okay.
So
I assume
you can eat turkey. If you want to be really careful, microwave it for 30 seconds. But you can eat the turkey.
If you take one message from this, it is you can eat the turkey.
Eat the turkey. Soft cheeses.
The vast majority in this country, unless you're in some shishi restaurant, are going to be pasteurized.
Exactly. If you're traveling in Honduras and there's an awesome cheese roadside stand, probably not in your first trimester or at all, maybe, if your body's not used to that. But no.
Generally good life advice. Yeah.
You know, don't buy roadside.
Don't buy roadside
Honduras
cheese.
But no, turkey's okay. I mean, people are like, they're so scared because of Google.
Are there
They're
any?
so scared.
I mean, okay, so caffeine and alcohol we've talked about.
Yeah.
So is alcohol
We didn't
out
talk
the
about
door?
caffeine.
Did we not? We talked about it before we started. All right. Yeah. Thanks. You're correcting my brain. So let's start with alcohol. Can we drink it all?
No, at the beginning, but it's okay if you found out you drank while you were pregnant but didn't know it yet. If it's like in the first month or the first 2 weeks and you had a glass of wine and then, or maybe you got pregnant because you'd had some glasses of wine. One never knows.
Happens.
It's okay.
Yeah.
It's okay. Alcohol affects the growing nervous system of the embryo, and in the first weeks of pregnancy, nothing's really developed enough that it could be affected by alcohol.
But once you find out,
no. Caffeine is probably okay. A cup a day of coffee is probably okay, especially for women who drink a lot of coffee. It's hard to go cold turkey off of it because they can get the rebound headaches. Ease off of it. You don't have to say, oh, I'm pregnant now, I have to drink no coffee.
yeah, I went, I think, to 75% caffeine decaf, then 50%.
Perfect.
And I think I'm down to 40 now. But I will say I went and got coffee on my way to work today and got a half calf cappuccino, which I swear it must be different in the stores than it is in my kitchen, because I don't think I blinked for 3 hours, which is so funny because I used to be able to slam, I would say, 4 of those in a day, no problem.
There are so many good charts online, here's where Google's good, that give you the caffeine content of different drinks, and you would be shocked how a certain brew from Starbucks is 5 times more than a Tim Hortons. Volume to volume being equal. It's really interesting. So I'm sure what you got was like high octane.
It had to have been.
Yeah.
I mean, I was charged and ready to go and very productive for about 2.5 hours.
That's why I love coffee. But I'm trying to get my husband to drink it because he's a little slow in the mornings.
Oh, yeah.
And I'm like, I want to try some now.
Giddy up.
Want to try some now? He says no.
How has he gotten through?
He
I don't
says
understand.
no. So, okay, coffee probably okay. One small study that I don't love, but I appreciate that it's a study, and I want to acknowledge it's out there, says that in the first trimester, maybe caffeine can cause miscarriage in high amounts. And I don't remember the amount in milligrams of caffeine where they saw that difference of miscarriage risk. But if you think about it, caffeine is a vasoconstrictor. That's why it helps headaches, because sometimes if you can constrict the blood vessels in your brain, it just kind of calms things down. It also, in theory, constricts the blood vessels forming to feed the new placenta and the growing baby. So high doses of a vasoconstrictor are probably not great. A cup a day of Tim Hortons or your Maxwell House in your kitchen is fine. And there's no reason scientifically to believe that that's dangerous.
Artificial sweeteners?
Well, I don't like them anyway.
Okay. I would say I don't know that any doctor is going to recommend them on a given day anyhow.
If you need it, just do sugar.
Okay. All right.
But then sugar's not great for the environment, so I don't know what to tell you.
All right. So stay away from it, eat healthy, drink healthy to the best of your
Done.
ability. All right, good enough. And my last question, and it was one I've been meaning to ask, I meant to ask back when we were talking about high-risk categorization. Advanced medical age. As I mentioned, I'm 34. So a friend of mine was 36 when she had her first baby, and she walked into her doctor's office, and she said, I'm advanced medical age, so I'm clearly high risk. And her doctor said, I'll decide. You won't.
Yeah.
Does 35 automatically put you into a different category?
Well, it's all about billing categories. So here's the real kick is when I was at University of Michigan before I came to WashU, our actual billing code on our checkout sheets said elderly if women were above 35.
Oh, that's just me.
Elderly primigravida, first time pregnant, or elderly multigravida, somebody who's been pregnant
thought you
before.
had emotional problems before.
Oh,
it
was so bad. It was so bad. 35 and up is a higher risk group. You can start to see more gestational diabetes, pregnancy diabetes, or pregnancy high blood pressure. 40 and above, we do recommend some extra testing at the end of pregnancy, putting moms on a little belt for 20 minutes a few times a week to watch baby's heartbeat, which is a proxy for information on how the placenta is sending blood to the pregnancy. But really, honestly, 35 is the new 30, which is 30 was the new 25. So as we learn more, as we're overall healthier and living longer, as we have access to better testing and preventative care measures, I think we're just going to see us pushing what's healthy for pregnancy further out. I mean, I see gynecology patients in my office too, and people come in, I'm 28, I'm single. Does that mean I'm never going to have children? Because I don't even have anyone in my life yet and I want to get pregnant. And I'm like, oh my gosh, no. It's okay.
Well, and I will tell you that's
It's
how,
okay.
and I mean, I have a full appreciation now for how people say they were surprised. I used to hear people say they were surprised to find out they were pregnant. It's like, how? How exactly were you surprised? And then I just have decided that no one ever expects there to be a second line. It's always a surprise. But in our case, I thought, there's no way this will happen quickly. I'm not in my 20s. My husband isn't either.
Yeah.
Like, this isn't going to happen that fast. But it works. And healthy bodies perform like healthy bodies.
Right, right.
All right. Well, thank you so much for your advice. Obviously, we have so much to cover, and we'll be back with you again, whether you like it or not, because I'm promising it now, and people are watching.
We'll have Ben and Jerry's next time.
Yes, Ben and Jerry's and Pedialyte. We'll see who wins. Who
Sounds like a
what.
party.
It's going to be so fun. That's what our new parties are. Thank you so much for joining us. This will be on Facebook for you to watch later. We'll catalog it on the St. Louis Children's Hospital YouTube channel as well. So be sure to pass along to all of your expecting mom friends and people who might find this information helpful. And we'll have more for you next week. Thank you for joining us.
Have a good day.